Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly.
This episode of the podcast, I'll be talking to you about wait times, a common health analytic metric. This episode is part of a series I'm doing deep diving into common health analytic metrics within the health informatics field. In the previous two episodes, I talked all about readmission rate. We talked about how readmission rates are generally calculated, what are some factors that can affect the readmission rate outside of direct hospital care, the emerging field of artificial intelligence and machine learning, and how algorithms are being developed to help predict patients who may be at risk for readmission rates, and much more. So if you're interested in learning more about readmission rates, definitely check out the last two episodes in this series. There are many different types of wait times considered within the hospital system. There are the number of days you might wait for your specialist to receive the referral from your family doctor to your first appointment with a specialist. There is the number of days you might wait for your scheduled surgery, and so on and so on. For the purpose of this discussion, we'll look at emergency department wait time. And this can be calculated as the number of hours it took between the time the patient registered to the time they're discharged or admitted into hospital. So although wait times might be calculated simply, in some cases, the factors that affect increasing wait times are complex, similarly to readmission rates. Here in Canada, wait times in the emergency department have been rapidly increasing as a result of the pandemic, staff shortages, and also the RSV virus that surged in the fall of 2022. And not unsurprisingly, wait times have been linked to another health analytic metric, which we'll discuss in future episodes, which is patient satisfaction scores. Imagine the longer you're waiting, and the case that you might leave without treatment can result in a declining patient satisfaction score. So one of the issues is that the emergency department might be seen by some as their first line of care. What doesn't help is the increasing wait times to see a family doctor. At least in Canada, it has been reported that fewer medical students are choosing family medicine than in previous years. And many doctors also retired during the pandemic or stopped practicing during the pandemic. Shout out to my doctor, who I definitely miss. So you have all these confounding factors, which are just creating a perfect storm of making it very difficult to find and retain a family doctor. Therefore, you might have a high number of non-urgent patients going to the emergency department instead of accessing primary care. Another factor is that people who frequently visit an emergency department might often be looking for help with mental health and substance use issues. This might be due to a lack of community support or follow-ups from clinicians or social workers, where they can turn to instead. The first line of defense would be the emergency department. So saying all this, it's really key to address some of the systemic issues leading to increasing emergency department wait times. As these wait times increase, you'll see an increase of patients who leave without treatment. And this metric can be described as patients who were initially registered but leave the emergency department, most likely due to increasing wait times. Unfortunately, these patients are at risk for worsening morbidity and mortality. So these are just some of the factors contributing to wait times within the emergency department. some of these systemic issues that exist. And in the next episode, we will uncover what are some innovative solutions being developed to help reduce emergency department wait times. So again, the purpose of this Health Analytic Metrics Deep Dive is that at the end of this series, I'll be creating a hospital key performance indicator dashboard using Power BI, which will include all the metrics which I've mentioned during this series. I've heard from many of you that you're looking to create a project that you can link to in your resume when job searching, and understanding the metrics that will be included on this dashboard is the first step. So in the next episode, we will continue our talk on wait times.
Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.